It is on, right? It seems low. And I'm just here to give you all some background on what we do. We are a small health department. I mean, we are responsible for the health and well-being of everyone in Dallas County. That's 105,000 people, give or take, because it changes every day. There's 9 of us here in our office. So we do a lot of cross training and different things. So I'm going to talk today about how health departments are governed, why they exist, and then the programs that we offer here at our health department. So governance, local boards of health are required to be had at least county level. You can choose to have a district board of health, but counties have to agree to do that. Local boards of health have 5 members. One of them has to be an MD, DO, or as of 2 or 3 years ago, an ARNP or a PA. That was just changed because many boards of health were having problems finding MDs or DOs, especially in rural areas. We have a very interesting setup. So local boards of health are autonomous, but they are appointed by local boards of supervisors, and they are funded by local boards of supervisors. So we basically put together a budget and then go ask the supervisors to fund us. There are we are very lucky here in Dallas County. We have a very supportive board of supervisors for us and our programming. There are many counties that fight for their funding for their health departments on an annual basis. So these are the things that are laid out in code, things that we will do. We will enforce state health laws and rules. And that means that we enforce what comes up in Iowa Administrative Code, that are health-related rules and laws. We can also, if we so choose, make and enforce local rules and regulations. And so in Dallas County, most of our regulations that are local deal with our environmental health programs, and I'll get to that in a minute. And then the Board of Health will employ persons as necessary for the efficient discharge of their duties. That's legalese for there's a public health agency. If there's not a public health agency at the county level, there are about 1/3 of the counties in the state of Iowa that contract with a local hospital. And so there are 97 public health agencies, 2/3 of which are county-based, 1/3 of which are hospital-based. There are 2 set up that the agency covers multiple counties, 2 counties, but those counties have their own boards of health, so that agency answers to 2 boards of health. And then there's Polk County, they're totally different. Their board of health is their board of supervisors, and then their board of supervisors appoints an advisory 5-member board that they utilize as a board of health, but all of their business actually goes through their board of supervisors. They are the only county in the state that's set up that way. Besides the things that we will do, these are the things that we may do, and obviously that's not a complete list, but provide population-based health services. We often have a, not argument, but discussion with people who work in healthcare about what population health is, because for us, it's the health of 105,000 people. And for people like, not to put you on the spot, you guys, it's your patients. And so that kind of comes up, and it sometimes people don't understand what public health does. So we provide environmental health services, and we engage in joint operations with partners to provide services. So obviously we do a lot of partnerships, and this meeting today is part of our partnerships. So I'm going to start with community health, because these are the programs that all of you in this room are probably most familiar with. Abigail and Natalie work specifically in community health. Abigail is our community health administrator. Natalie is brand new to us. She started in August, and she is a community health educator. That's a new position for us. We've never had a community health educator before, so we're all kind of learning as we go with her. And then Anne and Vivian and Christina, of course, are our health navigators. Programs that we do, community and municipal assistance for planning for the health and well-being of their populations. So for instance, Dallas Center, which is right up the road here, had a healthy hometown group. We assisted them with grant writing to add a skate shack to their outdoor skating rink so that people can utilize it more during the summer months for physical activity. We assist all the municipalities with those types of programs. We work with Dallas County Hospital, we work with Waukee Area Christian Services, and we try to bring all those partners together. And then obviously communication and education for the population, for health promotion and health maintenance. So that's, and above, I'm not gonna steal Abigail's thunder, but the CHA chip process works into all of these. We do the Pick a Better Snack program, which Natalie goes to elementary school and teaches kindergarten through 3rd graders about healthier snacks and physical activity. She does that once a month. March, you just finished oranges, citrus fruits. So we do health navigation, obviously, which is our referral process and resource navigation program. And then we do partnership and networking, both internal to the county with some of our county partners, as well as externally. We have kind of changed our focus a little bit on that this year in particular, and are doing more external networking and joining chambers of commerce, particularly to get that business person's perspective for the upcoming community health assessment. We do clinical public health. Amy Short is our public health program coordinator, and she is in charge of doing communicable disease investigation, surveillance, and follow-up. There is a list of diseases put out by the state Department of Health and Human Services that are reportable. And those diseases then have follow-up, and Amy calls and or visits people to interview them about where they may have possibly caught that disease, or to make sure that they're getting follow-up care, or to make sure it just doesn't pass on to someone else. She also does tuberculosis disease surveillance and treatment. So TB is diagnosed by a provider, and the state of Iowa will provide TB medications for free to people if the provider signs them up through that program. So we do both active TB and latent TB. The rules are very different for those two different diseases. Latent TB is pretty easy. It's anywhere from a 12-week to 6-month treatment. Amy goes and talks to the person and drops off a bottle of 30 pills. And then she'll go back 30 days later and do the same until they finish that treatment. Active TB, which is pulmonary TB and is considered very contagious, we actually go see that person, that client, every single weekday and watch them take their medication. It is called directly observed therapy, we call it DOT, and that treatment lasts 9 months. And so, yeah, that particular program, the state provides the meds and then an additional $1,000. We pretty much cover the cost of those visits, but we do see that patient and watch them take their medications Monday through Friday the entire time that they are on that 9-month regimen. And then Amy also does our immunization program. We are a Vaccines for Children provider. Vaccines for Children is a federally funded program that provides childhood immunizations. So kiddos who are 18 years of age and under, and they can get all of those normal childhood vaccinations if they do not have insurance, if they are Medicaid insured, or if they are an Alaskan Native or Hawaiian or Native American Hawaiian Native. There's also a provision for children who are underinsured, which means that they have insurance, but that insurance does not cover vaccinations. That's pretty few and far between, but we have seen some people that is the way it is. We also do flu shots here. We do way less flu shots than we used to because people want to go to Hy-Vee and get their 20-cent off fuel saver with their flu shot instead. So we can't offer that. Amy does our school nurse partnership and school and daycare audits, and the partnership and the audits kind of go hand in hand. So every child in the state of Iowa that is enrolled in public or private school has to have on file either a certificate of immunization or an immunization exemption. We have to audit for each and every child every single year. So Amy goes out and she visits the school nurses because they're in charge of putting together that paperwork for her, and she looks at a certificate or an exemption for every single child in the county. This year, I believe that was around 17,000 kids, because Waukee alone has about 12. And so the school nurse partnership comes into that because if school nurses get new kiddos in school and those kids are not on the required Iowa certificate, like the immunizations that they previously had, or they have no records because they're new to the country or anything like that, then the nurse can call Amy, and Amy will enter those immunizations into IRIS, which is the Iowa Registry for Immunization Services. And that way the nurse can then print off that certificate and have it ready for when Amy gets there to do the audit. We work with daycares to do the same. Other public health programs that we have here, this one's mine. I do the Emergency Preparedness Program. That is a federally funded program that goes through the state Health and Human Services Department and then filters down to counties. We are part of the 14-county region. The Central Iowa Healthcare Coalition is our name, and it consists of public health, hospitals, emergency management agencies, and emergency medical services agencies. So our region, because it includes Polk County, is the biggest in the state for population. We do exercises every year. The service area has to do an exercise where we tabletop evacuate at least 10% of patients in our area, which means that every year we evacuate one of the big hospitals in the Des Moines Metro because we can't hit that 10% level without that. And then the other hospitals that are in our surrounding counties, they get to switch off a little bit more. So that's one of the exercises we do. We also, this year, our exercise is gonna be, I believe, in April. We have other things we have to exercise on a 3-year or a 5-year basis, and we decided to throw them all together this year. So our exercise this year is going to be hospital evacuation, anthrax exposure, chemical exposure, there's one other one. Sorry, I can't remember it. But that brings all those agencies together, and we also work with long-term care in those exercises because, you know, sometimes we can shift, if we have to evacuate a hospital, we can shift people to a long-term care facility for care. And so those are, we don't actually move patients, it's just a tabletop exercise, but we've learned a lot. That exercise, we started being required to do that about 6 years ago, and I'm gonna throw Anne's husband under the bus. So her husband used to do the airlift, there's a name for it I'm gonna miss, for Mercy One, yes. He also had really good relationships with all the ambulances in town, and the first year we did this exercise, we were evacuating Mercy downtown, and he was in the room, I was an observer, and he called all of his ambulance buddies and said, we need them. Well, we were also evacuating Iowa Lutheran Hospital and one other one that was smaller that would have used Metro ambulances. And because the ambulances said, yep, we're all gonna go to Mercy, the other hospitals had to come up with something else. And so that situation, even though it was just a tabletop, really showed, okay, we have to use our emergency management agencies and coordination, and it wasn't something that they had ever done before, and so, that's the kind of situations that we exercise. And then we also do environmental health. So Ted and Toby are environmental health staff. They do private water well testing and closure, which I didn't put on here, mitigation. So there's a state grant through the Iowa, this one's through Health and Human Services. They also work a lot with DNR. That if you have a private well on your property, it's a rural property, they can come out and test it. They have funds to help you shock it if the fecal coliforms are too high. And then they also, if you have an old abandoned well on your property, they have funds to help you close it properly. And those funds are part of a state grant. So manufacturers and sellers of pesticide and herbicide products have a tax that is put on top of their products, and that tax funds that private well program. We do private septic system permitting and inspections. That's through the DNR. We do public pool inspections. We do tattoo agency inspections. Rabies and animal bite follow-up goes through the environmental health staff. So if there's a dog bite, usually people will call the police will call Ted. Ted will follow up to make sure the dog has been vaccinated or other things known on that. It's on the health side. We do not police. So we're not going to be the ones that tell you to put down your dog or to charge you with anything. But Ted knows all the rules behind, like quarantining the animal and if prophylaxis is needed depending on what kind of an animal it was. We do public health nuisance complaints, and in order to be a public health nuisance, it has to show a danger to the health of the population. The easiest one to explain is a rat harborage is the way they put it, but if you have an old abandoned house and it's full of rats, that would be considered a public health nuisance, and we would inspect that and work with the county attorney's office to make sure that that was mitigated. We do radon awareness and we sell test kits here for $10 a piece if anybody wants to test radon in their house. And then we also have a community sharps disposal program. We have one upstairs here in this building, and we also have one in Perry at the EMS facility. We are also a satellite partner for certain partners that want to have space in Dallas County. So we have an office that our senior health insurance information program volunteers use. They're here, one's here on every Monday, one's here every Tuesday, and they help people navigate Medicare. Connect to Careers is here twice a month for a satellite office. We store stuff for the Dallas County Medical Examiner because they're very hooked to the EMS department, and EMS's spaces are pretty compact. And then we host free STI testing once a month. So I always end a presentation with what we don't do. So this is a list of things that we probably get calls on pretty often that we don't do. We don't do clinical health care. We don't do physicals. We do only childhood vaccinations and flu shots. We don't do travel vaccines. But if you call and talk to Amy, she has a whole list of people that she can send you via email that can help you with travel vaccines. We don't do restaurant or food vendor inspections. A lot of states, that's at the local level, but here in Iowa, the Department of Inspections and Appeals and Licensing does that. Same with beautician barber inspections. We don't do animal control. I touched on that earlier with rabies. We don't do apartment landlord inspections, especially if those apartments are within city limits. That is a city issue. We have no jurisdiction over that. We don't do city regulation. You can call us and complain about your doctor and we'll listen, but we can't do anything about it. we don't endorse products related to health. So we actually ran into an issue with this about 10 years ago when we also did home health, where we suggested a fall button company and we only suggested one. And we got called on it by one of our clients. And so we don't endorse any health-related products. Abigail lately has been getting lots of influencers on Instagram who want us to endorse their athletic wear. We don't give money away. We don't have any funds to give money away. Anne gets asked often for money. I don't know why, specifically her in health navigation, but she does. And then we don't work in Dallas County, Texas, Alabama, Arkansas, or Missouri. We do get a lot of calls for Dallas County, Texas. I have gotten an Alabama and a Missouri. I have never gotten a Dallas County, Arkansas one, so yeah. But the reason I think that we get that is we do have a really nice IT department here at Dallas County, and they have us placed in Google searches really well, and people just search for Dallas County Health Department, and they don't look to see which Dallas County they're in. So we get a lot of that on social media as well. So that's all I have. Are there any questions?